proven alternative ways to heal common chronic digestive problems. What your doctor doesn't know can keep you from healing. Congratulations on requesting and downloading this free report. My name is Helen Chin Liu. I am the owner and the founder of the Healing Place in Medfield, Massachusetts. I am a certified reflexologist, energy medicine, and Reiki practitioner, performing therapeutic energy healing since 2006. My specialty is helping clients find relief from chronic digestive disorders. Digestive disorder statistics in 2004. Over $12 billion is spent on various digestive medication annually. There were more than 104 million people admitted to hospitals for digestive disorders. White females between the ages 15 through 65 and more are affected by digestive disorder more frequently. 236,164 deaths were documented as due to digestive disorder disease. What will this report cover? My colleague Cynthia Small and I will discuss the information in this report, which was compiled over a 6-year period as a reflexologist, energy medicine, and Reiki practitioner. From my past and current clients' digestive disorder experiences, I have seen men, women, teens, children, and infants with various disorders consisting mostly of constipation, acid reflux, indigestion, and or irritable bowel syndrome, known as IBS issues. These clients have sought traditional medicine solutions which have not helped completely, have exhausted all pharmaceutical means, and still have digestive discomfort. Want to be proactive, take charge of their own health. I will be discussing common digestive disorder cases that I see at my office on a weekly basis and how reflexology and energy medicine helps. I will share techniques that you can use safely on your own, although the fastest, most accurate results will happen by working with me directly, either in person or virtually by Skype. The tips I will be sharing are for informational purposes only and should not be considered medical advice. Please consult with your healthcare provider before starting any new health regimen.
This report contains information on the description, causes, and remedy options for indigestion, heartburn, irritable bowel syndrome, IBS, and constipation, as well as how to support your liver, kidney, and spleen functions. What are reflexology, energy medicine, and the digestive system? And sections including references, the conclusion, need more help, and about the author. Indigestion is the most common digestive system disorder and can be described as pain or discomfort in the upper abdomen. Also known as dyspepsia, acid reflux, or GERD, indigestion affects about 15% of the population in Western countries. Indigestion is not a disease. Indigestion is a group of symptoms which often include bloating, nausea, and burping. It is usually caused by stomach acid coming into contact with the mucosa of the digestive system, the sensitive protective lining. Stomach acids break down the mucosa, causing irritation and inflammation that trigger indigestion symptoms. What causes indigestion? Indigestion is usually related to lifestyle, what we eat and drink, and may be accompanied by other symptoms, such as fullness in the stomach or belching. Sometimes, indigestion can be caused by other factors, such as an infection or taking certain medications. Common causes include eating too much or too fast, eating too much chocolate, fatty and spicy foods, drinking too much caffeine, alcohol, and carbonated drinks, gallstones, being overweight, medication, and insufficient sleep. Remedy options: diet and lifestyle changes. If symptoms are mild and your indigestion is not occurring often, some lifestyle changes will probably ease symptoms. Try consuming less fatty foods, avoiding spicy foods, eliminating caffeine, alcohol, and chocolates, and consistently getting a good night's sleep of at least 7 hours. Holistic remedy: a combined ear, hand, and foot reflexology therapy is excellent for finding relief for indigestion. Average results are achieved within 3 to 4 sessions with a professional reflexologist, followed by a monthly maintenance reflexology program once indigestion is diminished. Heartburn. Despite the name, heartburn has nothing to do with the heart. It's a digestive problem that occurs when stomach acid comes into contact with the lining of the esophagus and the acid content of the stomach passes backwards up into the food pipe, known also as the gullet or esophagus. This irritation is known as acid reflux. Most people have experienced stomach acid reflux at some point in their lives, either as heartburn or acid regurgitation. Heartburn is annoying and may have a detrimental effect on a person's well-being. Sometimes the tendency for heartburn may develop into a mucous membrane inflammation in the food pipe, known as esophagitis. In the worst cases, esophagitis can become complicated with ulcers, which in rare cases may bleed or cause chronic anemia. Occasionally, scars from reflux esophagitis cause a tightening or narrowing stricture in the food pipe, making swallowing difficult. If this should occur, it is a serious condition which requires immediate attention. What causes heartburn? When the lower esophageal sphincter, LES, the valve that keeps stomach acid in the stomach, is weakened or relaxed, it does not do its job properly. This is the most common symptom of gastroesophageal reflux disease, GERD. Things that can weaken or relax the LES include eating certain foods, chocolate, fried and fatty foods, peppermint, coffee, alcohol, and sugars, eating large meals, eating shortly before bedtime, pressure on the stomach, including frequent bending over, tight clothes, lifting, and obesity, some medications. Heartburn once a month is considered mild, and about 20% of all adults do experience monthly symptoms. Weekly symptoms of heartburn are considered moderate, and only when your heartburn occurs daily is it considered to be severe. Remedy options. You can manage uncomfortable episodes with a change of diet to reduce acidic foods and or over-the-counter medications or weight loss. Only 5 to 15% of severe heartburn sufferers will find partial or temporary relief with these remedies. Holistic remedy: a combined ear, hand, and foot reflexology therapy has helped 100% of my clients find relief from heartburn in a relatively short time. Average results are achieved within 3 to 4 sessions with a professional reflexologist, followed by a monthly maintenance reflexology program once indigestion is diminished.
Client observation: Sam, age 67, has been coming for regular reflexology sessions since 2006. He has chronic heartburn due to poor eating habits, which he prefers to continue. He loves hamburgers and french fries and eats this combination at least 2 to 3 times a week. Sam takes antacid to lessen symptoms after they appear. To prevent heartburn, Sam watches his diet and comes for bi-monthly reflexology sessions. He values his sessions because they greatly lessen the occurrence of heartburn, especially when he is off track with his eating.
Irritable bowel syndrome, IBS. IBS affects 1 in 5 adults in the United States, making it one of the most common ailments diagnosed by doctors. IBS symptoms range from bloating, gas, diarrhea or constipation, to the more life-threatening colorectal cancer. They encompass disorders of the gastrointestinal tract, as well as the liver, gallbladder, and pancreas. IBS is a common digestive system disorder, which simply means inflammation of the colon. While most people experience digestive troubles once in a while, what sets IBS, also known as spastic colon, apart is belly pain and diarrhea, or constipation that comes back again and again. IBS involves abnormal gut contractions that tend to be chronic, characterized by abdominal pain, bloating, mucus in stools, and irregular bowel habits with alternating diarrhea and constipation symptoms. What causes IBS? The medical field doesn't know what causes IBS. It's believed that the signals between the brain and intestines are somehow disrupted. This miscommunication may cause abnormal intestinal muscle contractions. Anyone can develop IBS, but the condition is twice as common in women as in men. It's also more likely to affect people who have a family history of IBS. Remedy options. The first step toward managing IBS is to identify what aggravates your symptoms. Besides stress, common triggers include eating a meal, hormonal changes, and certain medications. It's important to note that no specific foods have been universally linked to IBS symptoms. Keeping a food diary may help you pinpoint which foods are problems for you. You may find it helpful to avoid caffeine, alcohol, and fatty foods. Getting more fiber or water may also improve symptoms. It's suggested to introduce probiotics or prebiotics and omega oils into your diet. Probiotics or prebiotics are specific types of bacteria that live in the human gut. They're known as friendly bacteria that have been found to relieve lactose intolerance, prevent vaginal and bladder infections and allergies, and also reduce the growth of harmful organisms in the digestive tract. Omega oils help to lubricate and keep food moving smoothly and efficiently through the intestines, thereby encouraging regular, healthy bowel movements. Omega oils provide nourishment to the intestinal lining cells and help to strengthen the intestinal lining and prevent the passage of harmful toxins into the bloodstream. Other treatment options can include medication and lifestyle changes such as diet, exercise, and stress management to control symptoms. Holistic remedy, a combined energy medicine and ear, hand, and foot reflexology therapy, has helped 90% of my clients to find relief from IBS. Results normally take place within 8 sessions with a professional reflexologist. A monthly reflexology program is suggested once gastrointestinal balance is achieved.
Client observation. Joan, age 35, has been coming for regular monthly reflexology sessions since 2008 to help calm her IBS symptoms. Joan is a teacher in a classroom of children under the age of 5. The job of balancing teaching, talking to parents, and working with administrators can be extremely taxing to her patients. Upon coming to the healing place, we determined Joan holds most of her stress in her lower abdomen region. Before reflexology, Joan would have monthly IBS flare-ups. After 3 months of regular reflexology sessions, she has reduced the number to 2 or 3 IBS flare-ups a year. Joan is pleased with the results of her regular reflexology sessions.
Constipation. Statistics show that more than 4 million Americans, 12 to 19%, suffer from chronic constipation in the USA, including children, adults, and the elderly. 2.5 million annual doctor's visits are for constipation, and more than $700 million is spent on over-the-counter laxative products annually. In a healthy person, the bowels should move at least once a day, and naturopaths suggest we should have a bowel movement after each meal. When we're constipated, the water in the feces is reabsorbed by the body, causing the stools to harden in the colon. Eventually, the colon loses its muscle tone, and the condition becomes chronic. Symptoms associated with constipation include infrequent bowel movements, hard stools, straining when passing a movement, cramps, abdominal bloating, flatulence, and a desire to defecate but an inability to pass stools. What causes constipation? Unbalanced diet, documented by research to be the most important factor in chronic constipation. Foods low in fiber and high fat, such as cheese, meats, and eggs, can cause constipation. Even though you have a craving for bread, spaghetti, or sweet foods, it is suggested to try to keep away from processed or white foods and eat whole grains. Lack of fiber. People with diets that include a good quantity of fiber are significantly less likely to suffer from constipation. It is suggested that women have 25 grams of fiber a day and men have 38 grams, or 14 grams per every 1,000 calories consumed. Lack of exercise, poor muscle tone, or slow or minimal peristalsis, the movement of contents through the gastrointestinal tract, increases the likelihood of constipation. And miscellaneous other causes, obesity, stress, nerve dysfunction, and habitual use of laxatives. Remedy options. Fiber and water should be included in your diet to help promote bowel movements and prevent constipation. There are two main types of fiber, soluble and insoluble. Soluble fiber dissolves in water. Insoluble fiber does not. Fiber cannot be digested. Soluble fiber transforms as it passes through the digestive tract, where it is fermented by bacteria. Soluble fiber absorbs water and becomes gelatinous as it does so. Insoluble fiber passes through the gut without changing its form. In doing so, the fiber sweeps through the intestines acting like a broom to keep food moving along and prevent it from sticking to the intestinal lining. Holistic remedy, a combined ear, hand, and foot reflexology therapy, is excellent for relief from constipation. Some clients have found results in one session, yet more often it will take several sessions, averaging 4 to 6 with a professional reflexologist before a regular elimination routine is established. A monthly reflexology program is suggested once constipation is eliminated to maintain positive results.
Client observation. Teresa, age 15, has been coming for a monthly reflexology session for chronic constipation since 2011. Teresa has seen several gastrointestinal specialists beginning at the age of 8, and after 7 years, Teresa still sees her doctor twice a year for monitoring. Teresa takes 2 types of medications daily to keep her gastrointestinal tract functioning properly. The medication only works 70% of the time for her. On days when she's stressed from being overscheduled with school activities and studying, Teresa had found that reflexology has not only helped her find relief, but also to help her to relax.
Support your liver, kidney, and spleen functions. Disorders of the digestive system are extremely common, ranging from the occasional upset stomach to the more life-threatening colorectal cancer. They encompass the gastrointestinal tract as well as the liver, gallbladder, kidney, spleen, and pancreas. If you are experiencing poor appetite, this is not a disorder in itself, but usually a symptom of some other problem. It may be related to a digestive system disorder or emotional factors such as depression, illness, stress, or trauma. Liver. The liver helps to digest and metabolize the food we eat, making it the most important organ in the body. If the liver fails, the body begins to fail too. Kidney. The kidneys maintain the body's balance, homeostasis, remove waste products, filter the blood, and balance the volume of fluids in the body. Spleen. The spleen digests food and retrieves nutrients from that food to help your body maintain its strength and health. Remedy options. Liver. Eat natural and organic foods rich in antioxidants that will fight disease and toxins. Eating vegetables high in vitamin B12 also helps the liver in digesting and metabolizing food. Avoid processed foods as well as those with high fat content, and limit alcohol intake. Kidney. The best foods for the kidney are organic fruits and vegetables, whole grains, and low-fat dairy. Limit sodium and alcohol intake. Quit smoking and be more physically active. Spleen. The best foods for the spleen are plain fruits and vegetables, proteins with healthy omega-3 fatty acids, and plenty of water, anywhere from 8 cups for women and 13 cups for men a day, depending on your level of activities. Avoid fatty food, tobacco, and limit alcohol intake. Holistic remedy. A combined energy medicine and ear, hand, and foot reflexology therapy has helped many of my clients to encourage toxins to move through digestive tract and filtering organs. With every client, regardless of health or illness, reflexes for filtering organs and gastrointestinal tract are worked on. It takes an average of 4 to 6 reflexology sessions before filtering organs are supported. Once improvements are routinely apparent, continued monthly maintenance reflexology sessions are recommended to balance filtering organ functions. Reflexology, energy medicine, and the digestive system. What is reflexology? Reflexology is a science and an art. It is an ancient healing modality that has been around for more than 5,000 years. It originated in China and Egypt. Reflex points on the feet, hands, and ears represent the body in miniature. The nerve pathways in each foot create an electrochemical flow that communicates with the entire nervous system. The principle of reflexology is that reflex points in areas, meridian pathways, and chakra, energy centers regions connect with a specific organ, gland, or body part. Through the application of pressure, using specific thumb and finger techniques, reflexology works with the peripheral nervous system and encourages the body to relax. Reflexology promotes the reduction of stress, reinforcing the body's ability to stay healthy and vital. This preventative modality encourages wellness through empowerment, understanding how your body can heal, and enabling your body to relax and gain homeostasis. Working the reflexology intestinal reflexes in the direction of peristalsis can help move contents through the gastrointestinal tract. The relaxation induced by reflexology helps the body switch over to the parasympathetic nervous system, which supports the whole digestive process. The parasympathetic nervous system is responsible for the unconscious regulation of internal organs and glands. Breathing, for example, is a parasympathetic process. You would breathe regardless of whether you are conscious about breathing or not. Reflexology promotes the harmonious contraction and relaxation of the diaphragm, resulting in a rhythmical massage of the abdominal organs. Reflexology helps to release muscular and emotional tension, both of which can severely hamper the digestive process. Reflexology can unblock congested energy, promoting a free flow of energy through all channels so that the digestive process from the mouth to the anus can work effectively. And the stimulation of reflexology decongests energy pathways, allowing the digestive system to work optimally, as reflexology does for all bodily systems. Benefits of regular reflexology sessions. Reduced stress. When the body is stressed, our body's immune system is overworked and overtaxed, causing the body to break down. Stimulating reflex points on feet, hands, or ears gives the body the ability to release stress instead of storing it in the organs. Built-up immune system. When the body is relaxed, the ability to fight off infections increases. Toxin elimination. One of the biggest killers of the body is the inability to remove toxins efficiently. We are exposed to air, food, electronic, and environmental toxins that the body is removing constantly. By stimulating the reflex points for all the filtering organs, such as the liver, kidney, spleen, and lymphatic system, the body's ability to remove toxins is supported. Improvement in circulation and energy. If waste products and toxins can efficiently be eliminated, your body will have the ability to increase oxygen, blood circulation, and your energy level.
Reflexology tips to relieve stomach and constipation discomfort. In an average professional reflexology session, approximately 55 steps are carried out per foot. Not only are reflex points that address the gastrointestinal system addressed in a 60-minute session, but also points impacting the brain and endocrine, reproductive, respiratory, cardiovascular, and musculoskeletal systems. Below are 4 reflexology steps out of the 55 that address stomach, liver, spleen, and bowel elimination function to try at home. I also have on my YouTube channel, Healing Place Medfield, You could look for a 2-minute video demonstration on how to use these techniques if you have difficulties in following the diagram. Looking at the diagram below, start each of the 4 segments with the right foot. Have your left hand support the right foot while the left hand walks with medium pressure with the appropriate location of the foot. After 3 repeats, switch to the left foot, supporting the foot with your right hand, and use your right hand thumb. Perform these 4 steps once every other day for a week. It will take about 3 minutes to do these 4 steps on both feet, assuming that you are focusing, maybe taking only 1.5 minutes per foot. Remember, this is only 4 steps out of 55 professional reflexology steps. After your mini self-session, drink plenty of water to encourage intestinal waste to move. If desired results are not achieved, or if more results are desired, please call the Healing Place at 508-359-6463 to schedule a professional reflexology session or a free 60-minute consultation.
What is energy medicine? In energy medicine, we bring things into balance so the body can function more effectively and simply perform the functions it is meant to, so our bodily systems work together. When we talk about energy, we're really referring to 2 kinds of energy fields. Putative energy fields. These can't be measured with traditional technology. These sound energy therapies are created to resonate with the body to promote healing. For example, music therapy has been shown to lower blood pressure and to reduce pain and anxiety. Treatments include audio techniques such as magnetic, music, radiation, and tuning fork therapies. Veritable energy fields, these can be measured and include vibration and electromagnetic methods such as visible light and lasers. Energy medicine refers to techniques that involve the putative energy fields. Healing methods can use all of the senses: sight, touch, audio, taste, and smell. At this time, there are no conventional methods to measure this type of energy work other than the feedback of clients. By understanding the root of our health issues, we learn where the energy in our body is deficient or excessive. Being conscious of the activities in our lives, we can avoid and remove energy blocks from our bodies and encourage our own healing. Energy healers can normally sense where energies are blocked in the body, causing illness and health issues. All living bodies are infused with a subtle energy or life force. Energy healers work with the 7 main energy centers located on the spine, known as chakras. If our chakras are balanced and open, they help promote general health and well-being by ensuring the free flow of life energy throughout the body. When a chakra becomes blocked, damaged, or muddied with residual energy, then our physical and emotional health can be affected. It's believed that blockages in the flow of vital energy eventually result in mental, emotional, and/or physical illness. By removing these blockages and maximizing energy flow, we enable the body, mind, and spirit to function optimally.
I have found that most clients' digestive disorders are genetic. I have also noticed that many of these clients have common energy and lifestyle traits. They usually eat on the run, live stressful lives, do not have regular exercise routine, overschedule their time, and worry a lot. With digestive disorder cases, energy imbalances shows up in the organs in the mid and the lower part of the body, which can lead to health issues. Over time, if unprocessed feelings build up and turn into anger, bitterness, and resentment, these emotions can be the seeds to many health issues. I have listed the organs and glands and which emotions impact each one.
Organ or gland. The large intestine. Personality traits include people who hold on to their past, making them unable to move on. Associated health issues, infections, parasites, IBS, and colitis. The small intestine. People who are overstimulated and cannot process their stuff. Associated health issues include obstructions and diarrhea. The bladder. People with fear of letting go and anxiety. Associated health issues include cystitis, infections, stones, and incontinence. Spleen. People with obsessions, harboring old or stagnant thoughts or feelings. Associated health issues include autoimmune disorders. The liver. People holding on to anger or who feel like a victim or feel powerless. Associated health issues, hepatitis, cirrhosis, and jaundice. The gallbladder. People restraining themselves from expressing rage or bitterness. Their associated health issues are emotions which can cause rage or passion. The kidneys. People who hold on to old emotions, shame, and criticism. Their health issues include kidney stones and renal failure. And the stomach. People who have difficulty processing ideas. Associated health issues include ulcers and heartburn. People with digestive disorders have a special energy profile about them. They have a tendency to overextend themselves to others. They're people pleasers. They're very empathic, taking on other people's worries and pain. They worry about what people think of them, look for self-approval from others, have poor personal boundaries, and often have one major worry focus, for example, finance, work, family, or mate.
Client observation. Cheryl, age 47, has been coming for reflexology since 2006. She suffers from constipation and lower back problems whenever she worries about her finances. Through active energy medicine healing session, Cheryl understood why and where she stores her worries. We were able to release her energy blocks through energy medicine after 6 sessions. Cheryl has been pain-free since 2007.
Benefits of energy medicine. Energy medicine is based upon the principles that the health of the mind, body, and spirit is anchored in the body's systems. Since most of us live a very stressful life, it is believed most diseases are stress-related, and that energy-based therapies can help decrease stress, anxiety, and depression. Energy medicine lowers blood pressure and slows down breathing. It can also help to turn off the fight or flight response caused by stress. It can open energy channels to prevent illnesses. It opens pain centers so that energy flows freely throughout the body, and energy medicine can boost the immune system by reducing stress. References: National Digestive Diseases Information Clearinghouse, NDDIC, 2004 statistics. en.wikipedia.org/wiki/dyspepsia. What is Healing Touch? Kaiser Permanente, Healthwise Staff, June 29, 2011.
Conclusion. I hope this information has been helpful in providing insights about what impacts your digestive function, both positively and negatively, and what actions you could take to be in charge of your own healing. Please remember that this report is strictly informational and not intended for medical purposes or diagnosis. Please discuss this information with your health provider before you start any new health regimen. Need more help? This report is only the starting point to give you basic information and tips that you can try. Most people find some temporary relief by applying these changes and/or trying reflexology on their own. For quicker and more lasting results, however, consider working with a professional reflexologist. A certified reflexologist will not only strengthen your gastrointestinal and elimination reflexes, but he or she will perform complete reflexology protocol that will support your endocrine, respiratory, reproductive, musculoskeletal, cardio, and spinal functions. Before you know it, you will feel better, experience more balance and calm and more normal digestive functioning and enjoy better sleep. If you're looking to call a qualified expert, feel free to pick up the telephone to schedule a free 60-minute consultation. You don't have to suffer any longer or go it alone in the world of confused and sometimes ineffective medical treatments. Now you have decided to become proactive with your health care. I can help. I work with clients in my office in Medfield, Massachusetts, or virtually by Skype. I would be more than happy to talk with you about your health issues with a free 60-minute consultation to find out how I can be of service to you or whether you need other resources that I can recommend. Please call The Healing Place at 508-359-6463. A little bit more about me. I am a highly trained reflexologist with certificates in foot, hand, ear, pediatric, weight management, fertility, musculoskeletal, and canine reflexology from the New England Institute of Reflexology in Wareham, Mass. I also earned a certificate in teaching Introduction Relaxation Reflexology. And also in 2009, I received my Energy Medicine certificate through a 3-year program with Reese Thomas Institute of Energy Medicine in Medway. My Reiki certificate came from Clear Self-Care in Milford, Massachusetts. In addition to offering healing services where many people have found relief from their physical struggles, including but not limited to pain and embarrassment, I also teach energy healing classes at my office in Medfield and also at Tri-Valley Regional High School in Franklin, Mass. I also host an educational cable TV show called Holistic Healing, where I talk to experts in various energy healing modalities about their work. I'm in the process right now of developing a line of self-help reflexology DVDs to show individuals how to do reflexology on themselves at home. I am also a member of the Massachusetts Reflexology Association and Reflexology Association of America, as well as an active member of the Dream Factory community, a women's support and networking group in Medway, Massachusetts. So feel free to pick up the telephone or even email me at wellness@healingplacemedfield.com, and we could start you on the road of good health. Thank you so much.